Just Be is a national storytelling campaign that highlights the unique personal stories of people directly affected by hepatitis B. The main goals of the Just Be campaign are to empower people with lived experience to share their stories and to use their voices in order to increase awareness and educate the public about hepatitis B, to support advocacy efforts, and to raise the profile of Hep B as an urgent public health priority, to combat Hep B-related stigma and discrimination, and to help promote Hep B screening, vaccination, linkage to care, and treatment.
It's been a wild ride. I'm on medication now. Most days are still tough, but my liver is healthy. The struggles and successes, they're all linked together. I feel more comfortable in my own skin. I'm learning from my past, and I'm living with hepatitis B.
Some doctors don't always know as much about hepatitis B as those of us who have it, so it is important to find a doctor who is knowledgeable about the treatment of this condition. Now I monitor myself more regularly, get abdominal ultrasounds, live healthier. I want to be there for my family, for the grandkids I hope to have one day.
And me? I'm a hepatitis B caseworker and interpreter. Every day, I meet people who are newly diagnosed or going through treatment. I see faces of confusion and fear turn into faces of understanding and bravery. Our family story could have been different, but with support and knowledge, we were able to transform something that seemed devastating into something beautiful. Hepatitis B doesn't have to be an end. It could be a new beginning.
In Nigeria, many people don't even want to get tested because treatment is either not available or costs too much money. They say, what's the point? In the US, the services are here, and I want to make sure that people of African origin know there are resources. I want to end this silence.
We were left to connect the dots because the medical profession is failing to address an epidemic that kills more than 700,000 people a year. It's bad enough that hepatitis B is a silent killer with few symptoms until it's too late. It's also ignored by Asian cultures that consider talk about deadly diseases to be taboo. Sometimes I wonder if hepatitis B is being ignored here in the U.S. just because it impacts so many Asians, especially given the country's history of discrimination toward immigrants. We're not just trying to cure cancer, we're trying to prevent it before it happens. The biggest battle is against ignorance amongst patients and doctors. We can do this. Just be proactive.
Just be supportive.
Just be honest.
Just be open.
Be hopeful.